What I'm going to do is heat up a barred Parker, so a 25 blade barred Parker, and warm it up, and I'm going to actually take a section out of this maxillary occlusion rim and start setting the denture teeth. Again, the occlusion rim is going to be our guide, but we need to make some space for tooth positioning. And so I guess you'd have to say, as we do this, we're making some guesstimations based on the appearance of the occlusion rim that hasn't been removed yet, because we're going to set these teeth with symmetry in mind. So as I see, I can use just a hot blade and section through there, and I'm cutting out an area hopefully large enough to set the central incisor, the lateral incisor, and the canine on one side of the arch, in this case on the right side, or I'm sorry, the left side, and then we'll set the teeth on the opposite side. So just taking a big piece out of this thing, and I know you might say, oh, I've lost all my guides, but I really haven't, because I know where the incisal edge of the tooth is supposed to sit, because I've retained my markings on the cast, and again I'm using the form of the opposite side to help guide my positioning of the teeth. So at this point, a little trick I learned some time ago about arranging teeth is to basically make a little wax root on the denture tooth, and then use that to help set the teeth. Lots of times you'll just see people make a sort of a little block section out of the occlusion rim and set the denture tooth back into a sea of wax, and I find that difficult to manage later on, particularly when you're trying to finally contour the your wax up for the trial denture or wax try-in. And so this is a method of accomplishing that. And again, I just take some base plate wax. Obviously there's all types of base plate waxes, and select the one you like the best, but all I'm doing is just warming up a piece, and you can see I'm going to start to create sort of a little peculiar looking wax root, but I think you'll get the idea once I get it stuck on there what I'm doing with it. Here basically you can see the little wax root that I've stuck on the tooth, and then this gives me a lot of latitude as far as positioning the central incisor. So I'm placing the central incisor, and if you notice I'm trying to get the incisal length correct, and we need to move that down a little bit. So I use this flat plane to help guide me in positioning this tooth, because remember, in the occlusion rim we've established where we want the incisal edge, we've established the length, but we've also established tentatively what we want our posterior, or I should say our occlusal plane to be, anterior posteriorly, and this was established by using a Fox plane. If you're not familiar with it, you can find them, and it allows us to tentatively determine the occlusal plane by paralleling it to the ala tragus. So that's where we are. Remember, ultimately what's going to guide the position of the posterior teeth and the occlusal plane is from the tip of the mandibular canine back to 1/2 to 2/3 the height of the retromolar pad. And as we get to that point, I'll try to demonstrate what I'm talking about. So as you see, I rather quickly was able to place the central incisor. It appears to be in the midline. If you notice, it's also in the same plane as the wax rim that we contoured previously to help establish the position of this tooth. So that's one. So let's see what we do with the lateral incisor. Again, same methodology, just create a little wax root or a little wax tail, whatever you'd like to call it. Again, this assists in the positioning of the denture tooth. This particular wax I'm using is relatively soft and sticky, and it has some advantages. There's also some disadvantages, but at least for what I'm doing at this point, there are some advantages because it's relatively easy to, number one, to get it to adhere to the record base, and number two, to be able to move it back and forth. So again, positioning the tooth, I'm kind of guesstimating as I look to the opposite side where the arch or arc of these teeth are going to be in the setup. We want to have the necks of the teeth in and the incisal edge out toward the occlusal plane. And if you notice, I made the lateral incisor just slightly short of this occlusal plane that we've established, so it's about 1 millimeter short. And in general, in an unworn dentition, this would be considered an aesthetic and an appropriate positioning of the lateral incisor. So again, we're going to do the same thing. Again, you see we're following the arch form and have the tooth position relatively quickly, and we'll go ahead and get the canine. The position of the central incisor guides the entire setup. The position of the canine also will end up guiding the positioning of the posterior teeth. And one of the things that is important to remember is that when you're looking from the anterior view, as you're looking at someone's face, you're not able to see the distal of the canine. So it basically turns the corner. It is the corner of the mouth, and it's something to keep in mind, because the more display you have of the distal, the more unaesthetic it appears, the more unnatural it appears, and it gives more of the denture appearance that becomes quite obvious. So positioning the canine is, I can't say it's necessarily tricky, but it's something that you want to pay attention to as you're arranging these maxillary teeth. So again, same process. Make a tail or wax root and position the tooth. I think I removed enough of the wax rim that I'll probably be able to get the tooth to seat in place. Sometimes if you don't trim back enough, you have to trim the wax rim back a little bit more. Again, it's not a big deal because we're again trying to duplicate some symmetry with the opposite side, and so we leave the opposite side intact. So let's go ahead and see if we can't get this canine set in the right position and take it from there. So I'm doing the same process as I did before, using the little tail to help position the tooth. We want the incisal edge, or the tip of the canine, to be in the same occlusal plane as the central incisor, and I'm going to take a look at it from the anterior myself, and maybe the lateral needs to be rotated just a little bit. It looks like it's not really in the axis that we'd want it in, so I'm going to rotate it a little bit, and again take a look at it from my point of view and see if that tooth position is reasonable. Again, positioning the canine really helps determine where the posterior teeth are going to begin to be arranged. And so you can take a look. I've kind of got my thumb over it so that the wax itself isn't a distractor, but at least initially this seems like a relatively reasonable positioning of the teeth. So what I'm going to do is I'm going to tack these teeth into place, and then we'll go ahead and move on to setting the opposite side. So here you can see I've just made some addition of wax just to help secure the denture teeth in place. And again, the important thing is when positioning is to maintain the position of the incisal edge. So you'll notice that the canine and the central incisor both touch the occlusal plane, and also if you notice we've done a reasonable job of maintaining the arch form. So what I'm going to do is the same procedure I did before. I'm going to section out a portion for the opposite side so I can set the central, lateral, and canine on the opposite side. then I'll come back and show you what that looks like and take it from there. But the technique remains the same, making that little wax tail, positioning the tooth, and then ultimately securing them in place with some additional wax. As you can see, I've also added a little wax to the lingual. I am not making any attempt to festoon or contour the denture base at this time. All I'm doing is just securing the denture teeth in place. So as soon as I have the next 3 teeth placed, then we can look at the maxillary anterior 6 and go from there. Well, here I've sectioned off the opposite portion of the occlusion rim, and something that I didn't show you previously, but I should show you now, if you can see, is the mark that I have right there basically indicates where the position of the tip of the canine would be. Again, remember we took an interpupillary distance and marked that position on the occlusion rim at the time that we did the jaw relationship records, and now I've transferred that to the cast. So on the one side, I think you can see where the tip of the canine and that little red mark are pretty close, and so we'll see if we hit that correctly this time. Another little thing that happened is a little portion of the occlusion rim has popped off of here. I'm not too concerned because I still have enough areas to tripod this my flat plane and still be able to continue to position the teeth. Another little aspect of doing wax ups, but again, at this point I'm not too concerned. So I'm going to go ahead and position the rest of the teeth, and then you can take a look at that. So hopefully here you can see that I've gone ahead and set the other 3 maxillary anterior teeth, and again, this is just using the same technique of making little wax roots and placing the teeth. Hopefully you can see that the central incisors are more or less touching the occlusal plane, the canines are touching the occlusal plane, and the lateral incisors are slightly above that occlusal plane. So also you should be able to see that we've done a reasonable job of following the arch form that we had established in those the original occlusion rim. Okay, I've gone ahead and secured the remaining maxillary anterior teeth into position. Again, not trying to really contour the contour and festoon the wax for the final try-in, but just mainly to secure the teeth to the occlusion rim. So hopefully you can kind of see from this view that we have them locked into place. We've pretty much followed the arch form, and one subtlety that I didn't want to overlook was the positioning of the canines. Again, as I say, the canines are the corners of the mouth, and you'll notice from this view that the distal tends to point to the posterior on both sides. The other thing that makes the tooth arrangement look a bit more natural is the position of the neck of the tooth relative to the incisal edge. Remember when we were talking about setting the anterior teeth, that the neck of the tooth was in relative to the incisal edge, so it's got a little bit of a cant to it. I don't know if this shows up particularly well or not, but it has a little cant to it. Whereas when we start talking about the canine, actually the neck of the tooth is out a little bit more than the incisal edge, so we pretty well rounded up all the incisal edges along the proposed arch form that we determined with our occlusion rims at the time of the jaw relation records, and then tried to duplicate that with the positioning of the teeth. So the other thing I want you to notice is I've done all of this off of the articulator. The articulator wasn't required because all the landmarks and guidance that we needed was already on the cast by transferring the position for the central incisors with a mark, and also by the adjustment of the occlusion rim. We were able to maintain what will be our proposed occlusal plane. So now I'm going to have to go ahead and place this maxillary cast on the articulator and place the mandibular cast on the articulator, because at this point the position of the lower anterior teeth are going to be guided by the position of the maxillary anterior teeth. So I'll get that squared away and we'll continue.